Moving on to slide 9, general surgeons who perform major surgical procedures in a health professional shortage area, also called an HPSA, will get a 10% bonus for these major procedures between January 1st of next year and December 31st of 2015, according to the new legislation. Again, this is another example of your doctor has to be enrolled in Medicare, in this case as a general surgeon, which is specialty code 02 as their primary specialty. In some areas, and in particularly in HPSAs, other surgeons might be performing a lot of what we would refer to as general surgeries, but the doctor does have to be registered with Medicare as a general surgeon to qualify for this bonus. The term major surgical procedure is used here. That refers to a surgery with 10 or 90 global days. You can determine how many global days a procedure has by checking the Medicare physician fee schedule. It lists all the global days of every CPT and HCPCS code there. As far as designating whether you're in an HPSA, in the past, practices in HPSAs used a modifier to denote that fact. In many cases, it's no longer necessary to do so. Medicare will adjust your payment accordingly if you provide services in a zip code that falls within a pre-designated HPSA county. If you practice in a county not designated as an HPSA, but your town is one, you will have to append modifier AQ, which stands for Services Provided in an HPSA, to your claims. And you can visit the CMS website to determine whether your location qualifies. Also, we've got a link on slide 19 that can show you where to go on CMS's website for more information if you need more on that. All right, heading on to slide 10. You'll see that the healthcare legislation also extends the exceptions process for outpatient therapy caps. That's in section 3103 of the new legislation. Under the exceptions process, which was originally enacted in 2006, Medicare will continue to pay for therapy services in excess of the cap if the services are considered medically necessary. Outpatient therapy service providers can continue to submit claims with the KX modifier when an exception is appropriate for services provided between January 1st and December 31st of this year, 2010. Currently, as you might know, there are two separate outpatient therapy caps. The first one is $1,860, and that's combined limit for physical therapy and speech-language pathology services. And then there's a separate cap for the same amount, $1,860, and that limit is for occupational therapy services provided during one specific calendar year. Moving to slide 11, this part of the law affects labs. This was another big issue that people were interested in and struggling with, and the legislation sort of cleared this up and made a lot of people happy, that labs are now affected by the new legislation. Retroactive to January 1st of this year, independent labs can submit claims to Medicare for the technical component of physician pathology services furnished to hospital patients, regardless of the beneficiary's hospitalization status, meaning whether or not they were an inpatient or outpatient, it doesn't matter which, on the date the service was performed. If your lab was previously denied for such services, you should contact your MAC, which is your local carrier, to determine how they want to make up the difference. Without this provision, independent labs would have had to seek payment directly from hospitals for these services. So this was a big one that made a lot of people pretty excited. Heading to slide 12, you'll see that the healthcare legislation institutes a 5% mental health bonus. And what this is an extension of an already in place plan, but providers were unsure of whether it would continue or not. Just a little background on that. 3 years ago, CMS reduced Part B payments for mental health services during what it called a 5-year review rule. To make up for that, Congress gave psychologists a 5% bonus payment in 2008, and that expired last December. That was December 31st, 2009. The new healthcare legislation restores the 5% bonus through December 31st of this year, and also makes the 5% bonus retroactive to January 1st of this year. So essentially, that means you should not see any interruption in the payment of your 5% bonuses. But if there was an interruption between January 1st of this year and March 23rd, ostensibly, which is when this legislation was signed, do contact your MAC for further advice. On slide 13, you may be familiar with the Physician Quality Reporting Initiative, also known as the PQRI program, which offers bonuses if your provider satisfactorily reports data on certain quality measures to Medicare. Many of you have already been participating in PQRI and want it to continue. And you'll see on this slide that the healthcare legislation extends the PQRI program for 2 more years into 2013 and 2014. The PQRI incentives and reductions that are applicable starting next year through 2016 and beyond are listed here on this slide. Basically, you'll see that in 2011, you can qualify for an incentive payment of a 1% bonus. 2012 through 2014, you can get an incentive payment of a 0.5 percentage point bonus. Then in 2015, instead of a bonus, you'll see there's a penalty of 1.5% for those practices that don't successfully report. And for 2016 and beyond, that penalty goes up to 2% for practices that aren't participating successfully in the PQR program. Interestingly, the healthcare legislation calls for an appeals process to be in effect as of next January 1st, 2011, for providers to seek a review of the determination that an eligible professional did not satisfactorily submit data on quality measures. And so those practices that feel they were unjustly denied based on their data submission efforts will be able to go through an appeals process, which the details of which have not been lined up. I believe there is a PQRI call tomorrow with Medicare, and it's certainly possible they may go over that, but the details may not have been put in place yet. Slide 14 applies to the timeliness of refunding overpayments. A lot of practices get overpayments, not always realizing it's an overpayment, but the new law really it sort of goes into great detail on this, and it says that if you receive an overpayment from Medicare, you must report and return the overpayment to the carrier within 60 days after the overpayment was identified or the date any corresponding cost report is due, whichever date is later. You also must notify the secretary, state, intermediary, carrier, or contractor in writing and inform them of the reason for the overpayment. And know that this legislation defines an overpayment as any funds that a person receives or retains to which the person, after applicable reconciliation, is not entitled.